Welcome to Mind Over Matter, where science meets soul and medicine meets meaning. Today, we are honored to have Dr. Julius Torelli, a visionary cardiologist who spent over 4 decades bridging traditional medicine with holistic wellness. His work redefines health by exploring how our thoughts, beliefs, and emotions shape the very philosophy of our bodies. Together, we'll explore the mind's profound power to heal and how gratitude and awareness can rewrite our biology. Welcome to the show. It's such an honor to have you.
It's a pleasure to be here, and it's an honor for me as well. Thank you.
Mhm. So, Dr. Torres, as someone deeply rooted in medicine, what led you to integrate mindset and emotion into your approach to health?
Well, it's been somewhat of a slow kind of evolution over what is now going to be 40 years, 39 years. But it really started coincidentally at the last week of medical school where I saw a patient. I was doing a family practice rotation. I saw her in the office and she had nausea, vomiting, dry heaves, and she couldn't keep anything down for about 3 days. And she was very sick. She was dehydrated. And we didn't know what was going on, but she was dehydrated. So we put her in the hospital. We gave her some IV fluids and we ran some tests over 3 days. And those tests came back all normal. And she was feeling a bit better. And so I went to discharge her from the hospital. And as I was writing her discharge orders, I sat down and was, making some small talk. And I said something to the effect of, well, we're going to get you home now where you can get some real rest because you can't rest in the hospital. That's always, people are always bothering you. And she said, oh, I wish. I said, what do you mean you wish? She said, I wish I could go home and get some rest. And I said, well, why can't you? And she says, well, in the last 6 weeks, my husband left me, my dog died, and my house burned down. And in that very instant, I had this awareness, or I would say it became intuitively obvious to me why she was sick because of this, what I like to think of as sort of emotional overwhelm, right? Each of those is a big deal in your life. And to have all three of those in such a short period of time is emotionally overwhelming, right? We would call that stress. I don't like that term so much, but regardless, there was a mental health or emotional component to that. I like to think of it that way is best. And but the weird thing was that I was now 2 days before my, graduating from medical school, and I had not been taught anything about this entity. So, of course, what ran through my head was, well, is that even an entity? Is that even a thing? Since I wasn't taught anything about it. And but I knew if I, you know, polled 10 people or 100 people, non-physicians, they would all say, "Oh, no wonder she was so sick." And yet there wasn't any instruction on this or any acknowledgement, in the traditional healthcare model about this. And so I said, well, maybe I can go to the library and learn about this because I have access to an entire medical school library, but I didn't even know where to look. And so I was very confused. And then of course I said, if this is a thing, what is it? And then how do you treat it? And so I was left confused. I was a very busy time for me because I was, finishing medical school. I was in Tampa. I had to move up to Cleveland and there was a lot going on. But that patience stayed with me. And then, as I went through my internal medicine residency and then my cardiology fellowship, and then I got into practice, I saw this type of issue repeatedly. In fact, it became obvious to me that this was what we today might call medically unexplained symptoms. So these are symptoms that people have where they come in and they're ill. They may be debilitated. They may be even disabled by them. Things like headaches or neck ache or chest pain or belly pain or fatigue or muscle aches. And they come in, they're very sick. They're having these symptoms and we run all of our tests and we don't find anything. All right. So headaches are probably the best example. of this. I'm going to call the poster child, migraine headaches, let's say, right? Yes, it is possible that when you have headaches, there's a physical cause, such as a brain tumor or something like that. But as you know, the great majority of time when people have headaches, they don't have brain tumors. They have symptoms, which again, in migraine headaches can be very debilitating, and we don't find anything. And then, well, we call them migraine headaches. And then in the medical field, doctors want to help. And so in our toolbox, we have basically two things in the Western medicine toolbox. You open up the toolbox, the first tray is procedures, surgeries and things like that. If you don't need surgery, which if you have a headache and you don't have a brain tumor, you don't need surgery, you take out that tray. The only thing left in the toolbox are pharmaceuticals. And so we start with pharmaceuticals and we try to develop pharmaceuticals because migraine headaches are very common, right? Or even tension headaches or all headaches. And so we start with, you know, medicines that might treat the headaches. We'll find medicines that might prevent the migraines, and maybe the disorders or the conditions associated with migraines. Maybe sleep, insomnia, trouble sleeping, or maybe depression or anxiety and things like that. And but the truth is that we know that these have an emotional basis. Even if it's not the only thing causing it. If it's belly pain, and let's say irritable bowel, there may be a nutritional component as well, but this stress or emotion plays a role. And how do you address that? And if you look at the number of patients, the percentage of patients who go to doctors, I think the percentage is higher of people who come in with symptoms that we never find, that we never isolate on a diagnostic test than those where we do find something. So that's a long-winded answer. Does that make sense?
Mm-hmm. Yeah, that's so transformative. Like it reminds us that healing isn't just about the treatment, but participation of the whole self.
Yes, that's the key to the whole gratefully well concept that it's sort of evolved over. You articulated and summarized it better than I think I did. Yes.
Mhm. Yeah, and you often speak about physiology of emotions.
Yes.
How do our thoughts and belief actually affect our body's chemistry?
Yeah, that's another, I believe, important concept that is underemphasized in the Western healthcare model, and I think it's underemphasized in Western society as well. We sort of know it exists, but I think the best way to understand it is through an example. So if you're home alone at night and it's late and you're going to bed and you're falling asleep, and as you're falling asleep, you hear this noise in the house or downstairs, and you get startled, right? Because it's an unusual noise. And so what happens, like, let's just say we were measuring we had you hooked up to some monitors to measure physiology. And so you got startled. So if we saw your heart rate and blood pressure, let's say, at rest when you were falling asleep, it would be whatever, let's call that baseline. Once you got startled, what would happen? The blood pressure would be a bit higher and the heart rate would be higher. Other things would be going on as well, but those two would change. Easy to measure. And then if you started to think, "Oh, wait a minute, did I lock the door? Maybe I forgot to lock the door, or maybe someone broke in." Now you have these thoughts that are starting to run away. Now, if you measure your blood pressure at baseline, it would have been something I startled, it got a little bit higher. Now, when you start having these anxious thoughts or fear-related thoughts, now the blood pressure is even higher yet and the heart rate's higher. Now your pupils are dilating, your palms might be getting sweaty, right? Those are very powerful physiologic changes that have occurred, and yet nothing has happened, right? Like you go downstairs, you find that something fell over that made the noise. So there was nothing there, but yet your body's response, the physiology of your body is the same as if someone had broken in, but yet it was all simply a thought, right? And so you can do the same thing if you were to relax and picture a lemon and really picture the lemon and feel the lemon and feel the little bumps on it and picture cutting the lemon and smelling the lemon and then imagine biting into that lemon, you would salivate, right? That again, there's no lemon. And so these are very, it's just the thought of the lemon. So these are, I think, just some simple examples to help people understand that imagine if those little simple things like getting startled in the house or picturing a lemon, if those can have that powerful of a change in your changing your as to changing your physiology. Imagine what if you were chronically anxious or chronically fearful every day about, your home situation or your job or something about your child or whatever it is, then imagine what's going on inside your body continuously.
Mm-hmm. Yeah. And like, do you think can chronic stress or fear literally alter our heart and immune function?
Yeah, so we have good evidence, that people that are under chronic stress, it affects the immune function. It depresses the immune system. We know that it raises, blood pressure. We know that children that grow up in the United States in um, you know, uh, suburban or urban, I should say, areas that are filled with violence and crime and things like that, their blood pressure tends to be higher than children who grow up, in the suburbs and the rural areas. So we have, there's plenty of evidence that shows the detrimental effects of what I again like to call emotion and emotional overwhelm and behavior as opposed to stress. But the stress is the more common term that we use in our society. Now, the flip side of that is we also have evidence to show that reframing your thoughts, such as there are many reframing techniques, cognitive behavioral therapy kind of techniques. I tend to use gratitude a lot. I use another one called I call it the benefit of the doubt method. But these are just reframing the thoughts that you're having, and it shows. There's a whole body of. In fact, that's how this whole thing started for me from a treatment standpoint. When I was looking for, hey, what kind of treatments can you use for these conditions? I found gratitude, and there's a whole body of literature, a whole body of scientific literature on the physical and mental health benefits of gratitude. And I've outlined those in my book. There's a book I have available that's called Holistic Health Pathways, Awaken Vitality and Resilience Using Intentional Gratitude. And that book specifically is tries to lay out the evidence that exists for the mental health and the physical and mental health benefits of gratitude.
Mm-hmm. Yeah, it's fascinating how emotions we can't see can leave such visible imprints on our cells and organs.
Well, again, we understand the neuroscience of this much better today than we did, let's say, 20 years ago, mostly because of, new technology like in fMRI and more sophisticated EEG measurements that we have where we can isolate a little bit. The regular EEG is just on the surface of the scalp. But we have techniques now that can um, basically give you better spatial resolution to know about the EEG changes, to know the functional MRI kind of shows what areas of the brains this is going on. And so we have a good understanding, a much better understanding, I should say. I don't know if it's good, but it's much better understanding of the neuroscience, the neurochemistry. It's all a chemical sort of reactions that occur within the brain that releases neurotransmitters and then hormone releases. And these neurotransmitters and hormones, like epinephrine as an example, that's adrenaline. When you release that, right, that causes those physiologic changes. Well, those releases incur. It's not instantaneously, but it's near instantaneous. All from a thought. We know that just thoughts change the neurochemistry of the brain and the hormonal sort of balance of the body.
Mm-hmm. Yeah, 100%. And Western medicine often focuses on the physical. So, how do you see the non physical dimensions of being fitting into the modern medical model?
Yeah, that's another great point and an important aspect, I believe, that has been what I like to think of as left out of the Western healthcare model. It's not that we don't know about it, we just don't appreciate it, and we don't really emphasize it or include it in our evaluation and treatment of patient. And so, because yeah, and I well, the fit, ultimately the symptoms manifest physically, right? So that's the headaches, belly pain, chest pain, muscle aches, whatever it is. And so and because we're so physically focused, that's where we tend to concentrate. So we have it's also easy to do studies, right? Or diagnostic tests or, whatever kind of studies to look at the physical, right? So you can measure blood pressure, or you can measure heart rate, or you can measure blood sugar, or you can measure cholesterol, or you could do diagnostic tests like looking for brain tumors or physical findings and things like that. And so the physical lends itself to science much better than what I like to call the non-physical dimensions of health. And I think of those as things like mental health, right? Behavioral health, emotional health, social health, cultural health, spiritual health. These are all aspects of a human being that I believe should be incorporated into the evaluation and treatment of a patient with physical symptoms. Again, that's not to say you ignore the physical, right? So the patient comes in with symptoms, let's just say headaches, they need to be evaluated. They need to unit because even though 99.9% of headaches are not caused by brain tumors do happen and other things in the brain that can cause headaches do happen. So you have to have a medical evaluation first. If you're having belly pain, right, you want to make sure you don't have appendicitis or Crohn's disease or, a bad gallbladder or something like that. So you need the medical evaluation. But once the medical evaluation is done, or in while you're evaluating the patient, also look at these non-physical dimensions of health. What is going on in this person's life, right? And then you can incorporate that into your treatment plan. If you find something like patient comes in with chest pain, you want to make sure they don't have heart disease or a heart attack or unstable angina. If they're having a heart attack, you don't want to, you're not going to ask them about, what's going on in their home situation and things like that, obviously, right? It may be important, but not at that. It's not important at that instant. You need to get that patient into the cath lab and get their heart attack into the hospital, get them treated, get them whatever has to happen, get a cardiac cath or whatever it is, open up the artery and things like that. And then you can deal with these other things later on. So you want to make sure there's nothing physical going on. That's first and that's foremost. And I want to make sure that's clear because I'm certainly not saying ignore, just look at the emotions and the mental health sort of aspect. You need to concentrate and make sure that there's nothing physical going on. If you don't find anything, that's when again you start to incorporate these other aspects of health to see how those might be affecting the patient's symptoms, and then incorporate it into your treatment.
Mm-hmm. Yeah, absolutely. And do you think medical education is ready to evolve to include these subtle layers of health?
That's a that's a great that's a very good way to put it. I mean, yes, I do think so because it's not, we're not. This is not this. We're not trying to throw the baby out with the bathwater, right? We're not saying everything in Western medicine is bad. We're not saying pharmaceuticals are bad. We're not saying surgery is bad. We're not none of that, right? If you have cancer, as an example, you might need surgery. You may need chemotherapy. You may need radiation therapy. Absolutely, right? But in addition to that, we need to we need to evaluate and treat these non-physical dimensions, right? So, in other words, a patient with cancer needs to have emotional support, right? And help them with their mental health aspects and maybe the social aspects, of what is going on. Those are very important. And we've got studies that show that, support therapy, group support is an example, right? People with cancer who go to group therapy tend to do better than patients who have cancer and are getting treated and don't go to support therapy. So the group support. That's just one, sort of example, right? But so even those patients where you have chronic disease, and known chronic disease that's been identified as like an autoimmune disease or heart disease or diabetes, um, that's fine. You need to treat the diabetes. You might need medicines and stuff for that. Absolutely. Right. But in addition to that, right, there has to be a lifestyle change as well. And people need to understand that. You see, it's the other problem in, especially in the West, is that we have given 100% of the responsibility for your health and health care to the physician or to the healthcare provider. And the patients generally take little to no responsibility. So if you, and let's use diabetes as an example, right? If you have diabetes, yes, you do have to have the genetic predisposition for diabetes. That's a given, right? But you can modify the expression of those genes based on your lifestyle. And so you come in and you're diabetic, you might need medicines, or you probably do need medicines to lower your blood sugar, things like that. Those are important. I'm not saying ignore that, but they're not going to get to the root cause of the diabetes. Diabetes type 2, I'm talking about, not type 1 diabetes. It's a lifestyle issue besides being genetically predisposed. So these people need the medicines, but then they also need to understand how important activity is in their life. I don't use the term exercise for the most part because a lot of times you say exercise, people think about going to the gym and getting on that treadmill or lifting weights. That's a form of exercise for sure that a lot of people aren't interested in doing or might think they don't have the time. But you just show them how they can live a more active life. That by itself will help improve insulin sensitivity in type 2 diabetes, which is ultimately, the issue is insulin resistance. Not that you don't have enough insulin, that you actually have too much insulin, but the insulin doesn't work well, right? In addition, they have to lose weight. They have to understand what they're eating. They may have to understand if they're overweight, why are they overweight? Why are they overeating? Sometimes there's an emotional component to that, stress eating and things like that. Maybe it's just habits, and things like that. So again, this is just taking what we already do in Western medicine and adding these non-physical dimensions of health, or paying attention or acknowledging that these, exist and that these are important and need to be included in the evaluation and treatment of the patient.
Mm-hmm. Yeah, that's such a hopeful vision. A healthcare system that treats both the body and the consciousness behind it.
Exactly. And again, a very good way to put it. It's just, that's why I call it a holistic approach, because you're just trying to look at the whole person, right? Holistically.
Mm-hmm. Yes, definitely. So, what a powerful exploration with Dr. Julius Torelli, reminding us that every thought is a signal to the body and every emotion a language of healing. If today's conversation inspired you, start small. Choose one thought of gratitude, one breath of awareness, and one belief that supports your vitality. Because the mind doesn't just influence matter, it creates it.